Hey, I'm Justin Schultz. I'm VP of Engineering here at Mission Mobile Medical, and I'd like to introduce you to Marcus, our care delivery platform. So what's cool about Marcus? Well, first of all, it's an EV. Second of all, it's going to bring hospital care to rural communities all across the United States. And how are we doing that different than any other mobile clinic out there in the world? Well, we made Marcus modular. The entire back third of the vehicle can be switched out for different care scenarios. So if we come back here and we take a look, from this portion back is completely detachable from the vehicle. It can be swapped out. So let's say you're doing advanced imaging. It could be a CT machine, it could be ultrasound for maternity care, it could be any type of ultrasound, right? It could be colonoscopies, it could be any type of imaging, all taking place in here. So each one of these modules can be upfitted for that particular use case and then taking that care out into the community. What's unique about that ability is the sense of being able to make the best use of your time when you go to those different appointments. So let's say you have a CT machine, for example. It's a pretty expensive piece of equipment to carry around and use here and there. It's much more effective to take it out there and know every appointment is intended for that CT machine. So by having that functionality, you coordinate all of those appointments, you head out, you have the appointments, and then you come back to your home base and you swap out for something else. Let's say it's a mammography machine, and then the next week you're doing mammographies around your community. And then you can go and repeat across the entire community, leveraging your ability to meet them where they're at versus trying to bring those patients to you like a traditional situation would be set up. Another unique aspect of this modularity is if you are a smaller healthcare system and you're partnered with another small healthcare system, you can actually share assets. You only need one vehicle. We call this portion the hub that's permanent and stays on it. Each of you can have your own hub part of the vehicle, and then you can swap between the different modules. So maybe one healthcare system buys the CT machine, the other healthcare system buys the mammography machine, and then you switch month to month based on the needs. So that's a little quick overview of the modularity of the system. Outside of that, like I mentioned earlier, it is an EV. So it does have the ability to go up to 210 miles on a single charge. It also has the ability to run an 8-hour workday without turning on a generator or any type of additional power source. So that opens up again the next generation of providing care out into rural America, giving them all the advantages that come with an EV. Outside of just being a green alternative, it keeps the vibrations down, it keeps the noise down, and it creates an environment that's much more inviting. Right now you can hear there's no sound, and that's not because this is plugged in, it's because there are no sounds. So it's super nice to have with that. It's also modular in the sense that if we wanted it to be diesel in the future, it could be that. If we wanted it to be hybrid, doesn't matter. We have all of those capabilities. Also, something worth mentioning here about this clinic, that it's an EV and how it's designed, is it drives very similar to a small van. Because the center of gravity is so low with the batteries and all of the equipment down low, it keeps the entire vehicle more agile. So we've had lots of people test drive it, and every time they get out, they tell us, wow, that felt like driving a Sprinter van or a transit van around. It didn't feel like a 30+ foot long vehicle that's close to 25,000 pounds. So that's a really cool, unique aspect of having an EV that you don't get with a typical vehicle. Now, as we work further forward, one aspect I wanted to point out that we're really proud of is this entrance. So first of all, we've got these really cool double doors that slide open to give you a nice, wide, inviting entrance. But the reason we actually went with those doors aren't only because they're cool, but because they allowed us to use these steps, which are really kind of neat because they fold up and slide into place. But again, we've seen these kinds of things before. That's not anything earth-shattering. What is really cool and what we are actually most proud of is the wheelchair lift that is housed underneath these steps. So what's unique about that? It's not any kind of a special wheelchair lift. The special part is the fact that it uses the same entrance that the steps use. So what that does is for someone in a wheelchair, gives them the sense and ability to come into the same entrance and have the same experience as any other patient entering the CDP. So we're really proud of that aspect. We didn't even realize it when we were designing it at the time, how big of an impact it truly was going to have. But based off of our user testing and understanding what the life and experiences are of folks that are in a wheelchair, that was a definite win for this project. So I could spend all day talking about all the cool features outside, but let's go inside and check out some of those features.